Are you considering studying nursing, or you're already a nurse and you really admire nurses, especially when you see them with their scrubs and their gowns, and you cannot wait to be a nurse? Become now in this video, we're going to dive into the untold realities of being a bedside nurse in Nigeria, beyond the glitz and the glam, and see if you can handle the challenges that comes with the profession. Hi beautiful people, welcome back to the channel. If you're still for the first time, my name is Shalona and I am a registered nurse, a registered midwife, as well as a professional makeup artist. And over here we discuss all things health, nursing, makeup, as well as faith. So if these are the kind of contents you're looking out for, please do not hesitate to like, share, as well as subscribe. Being a bedside nurse in Nigeria is a crucial and yet overlooked aspect of healthcare, as healthcare professionals work tirelessly behind the scenes to ensure that the patient receives the best care possible. But that is not to say that it's devoid of challenges. It's not all bed of roses. We have bedside nurses face an array of challenges that will test even the most seasoned healthcare professional. Number one that I want to talk about is bullying. And I know that bullying does not occur in every facility, but the facilities that it occurs, it can be quite toxic. And I'm talking of premium toxicity. For some reason, I noticed that it occurs between the older nurses and the younger nurses, that is the older generational nurses and the younger or newer generational nurses. There's this comparison that exists between these two. The younger nurses are usually looked down upon with disdain. They're usually picked on, honestly. Trust me if I tell you that if an issue should arise in your place of work between a younger nurse and an older nurse, the older nurse has a greater advantage because of her rank and because of her position, her age. Those are the things that come into consideration, I would say, irrespective of whether the nurse is right or wrong. And for me, my advice would be upcoming nurses, change the narrative. Okay, bullying is wrong. Whether it is at work or outside the work premises, bullying is wrong. There's nothing wrong in working in love. Don't make the work environment more stressful, okay, than it is for other people. We can all cohabit, we can all work together in harmony, and it makes things easier when you work in love. Number two I'm going to talk about is understaffing. I cannot emphasize this enough. It has become a normal thing. You'll find in most facilities the nurses are understaffed, in terms of the patient to nurse ratio. And it usually leaves the nurse feeling very overwhelmed because the patient's challenges now become unmanageable. So for me, I honestly look forward to a time where there's going to be greater employment, of nurses into the healthcare sector. So as, if not for anything, to optimize patients' healthcare, my opinion. Now, another I want to talk about is poor infrastructure. When it comes to poor infrastructure, the resources at your disposal are usually inadequate. So you are forced to be creative with what you have, using it to its most optimal level. And added to this toxic mix is the high patient load. Trust me, you're going to be feeling mentally exhausted and physically exhausted. Even if you're the most dedicated nurse, you are going to be worn. The thing is, the way things work is, as far as there is available bed space, if that's unit, whether there are poor infrastructures or not, whether the nurses are understaffed or not, you are going to work and attend to that patient, because that patient will be admitted into that unit and you have to work with it, because you cannot limit patients from desiring or coming for healthcare. And yet, despite all these incredible obstacles, nurses still find a way to deliver optimal healthcare to their patient. It's nothing short of a miracle, honestly, because it has a toll on you both physically, mentally, and emotionally. A typical day in the life of a bedside nurse is a never-ending cycle of chaos and uncertainty, if you ask me, because from the moment you walk into the unit, You are hit with a barrage of tasks that you have to achieve, from medications to wound dressing and everything in between. And you are the first point of contact for the patients, for the doctors, for the relatives. You're the one that they talk to first. So honestly, bedside nursing is one profession, one job that requires great deal of precision, great deal of skill, and a very high dose of patience. Being a bedside nurse in Nigeria, I would say, is not for the faint of heart. It takes a special kind of person, honestly, to be able to push through the challenges, push through the exhaustion, and keep on coming. But it's a calling that is extremely rewarding, as you are able to provide hope to the hopeless, help to the helpless, and you belong to this community that is just dedicated to supporting, to helping people. So I would say it's a very complex yet rewarding profession. Yeah. With that, I've come to the end of the video. I hope you liked it. I hope you learned from it. Please do not forget to watch my previous videos on nursing. I'm going to leave the link in the description box below. Okay, if you have any questions or recommendations, please let me know in the comment section down below. And until I see you next time, God bless you and bye, lovelies.